Dear friends, happy evening to all. Today is the World Physiotherapy Day. So, happy World Physiotherapy to World Physiotherapy doctors, especially the Indian physiotherapy doctors. The September 8th is the World Physiotherapy Day. So, this is the celebration day for all the states of physiotherapy doctors. Okay, first of all, I want to discuss about the history of the physiotherapy, how the physiotherapy was developed. So the year wise, institution wise, I have to explain about the history of the physiotherapy. First of all, who is the father of physiotherapy? The Mary Macmillan, US, United States of America, physiotherapist is called as father of physiotherapy. Somebody said the mother of physiotherapy, but my point of view, the father of physiotherapy is USA physiotherapist Mary Macmillan. So now we will discuss about how the physiotherapy developed. What is the history of the physiotherapy? In the 400 BC, the Hippocrates and Galen, both are physicians. They are believed to practice the physiotherapy techniques, and they are practicing hydrotherapy and massage therapy and some exercise. Okay, massage means not a simple massage, it's a scientific massage, anatomical massage, physiological massage. Massage means, again I said, it's not a normal massage, it's not a normal massage. Okay, it's not a entertaining massage. Okay, then the history of physiotherapy, the 400 BC, the Hippocrates and Galen, both are believed to practice physiotherapy practice, and both are initially they are using the physiotherapy techniques. Then the 18th century, after development of orthopedics department, the 18th century, the gymnastic exercise, that means the gym exercise used to treat a gout patients. So the gymnastics exercise used for some gout patients. So the 1813, the Per Hernick Link, he is a father of the Swedish gymnastics. 1813, in the year of 1813, the Per Hernick Link, he is a father of gymnastic. He is a father of gymnastic. Per Hernick Link. He is used some physiotherapy exercise and manual therapies in 1813. Okay. Then the Per Hernick Link, he who founded the Royal Institute of the Gymnastic. So the Per Hernick Link, the 1813, he is using some physiotherapy exercise. Since the 18th century, in the year of 1813, the word of Swedish, that is the Sujuknatics. This is changed as physiotherapist. That means physiotherapist. That time they are using some word, the word of physiotherapy in the 18th century. Okay. Then the 1887, the physiotherapy official registration done by Sweden Board of Health and Welfare Department. So the official registration in the 1887, the gymnastic exercise and the gymnastic exercise physiotherapist, they are given official registration. They are under an official registration by Swedish Board of Health and Welfare Department. Okay. Then the 1894, this is very important period. The 1894, that time 4 nurses joining together and they are started the Chartered Society of Physiotherapy in UK, that means United Kingdom, London. So in the British, 4 nurses joining together and they are started the Chartered Society of Physiotherapy in the 1894. Okay, then the 19th century, the modern physiotherapy developed. So the modern physiotherapy techniques developed in 19th century. In 1934, the School of Physiotherapy started in University of Otago, New Zealand. Then the first School of Physiotherapy started in Washington. Okay, that means Reed College. The the first school of physiotherapy started in 1914 Reed College in Washington, that is the military hospital. So the 1914 in the period first school of physiotherapy started. So that graduates called as reconstructive aids. The reconstructive aid graduates, they are given physiotherapy. Again I said, the school of physiotherapy started in 1913, Otago University in New Zealand. Then Reed College in Washington military hospital in 1914. So the graduates called as reconstructive aids, they are practicing physiotherapy techniques. Okay, so the 19th century, the orthopedic surgeons, they are using the physiotherapy. The orthopedic surgeon, they are using the women's who tried in physical education and treated the deformity of childs with disability childs. So in the 1916 outbreak of polio period, the orthopedic surgeons, they are using the women's who tried in physical education. That means the reconstructive aids, they are using that. Then the First World War. So the period of First World War, 1914 to 1918, that time the women recruited for injured soldiers to restore their physical function. So that woman called us reconstructive aids, and she given physiotherapy techniques, exercises, hydrotherapies, exercises, and manual therapy, like that. So the First World War, the women recruited to treat the injured soldiers in 1914 to 1918 period. Then actually in the 1918, actually the physiotherapist, that means the reconstructive aid graduates called us physiotherapist. So the name was changed in the 1918 period. Then after 1921, the Mary Macmillan, she is the father of physiotherapy, that means mother of physiotherapy. She is established physiotherapy techniques in the United States area. Then the 1935 to 1945, Second World War, the physiotherapist recruited to treat the injured soldiers. And they are they are appointed specialist area of orthopedic, and they are specialist area of the orthopedics. Then in the 1921, okay, so in this period, First World War, Second World War, the outbreak of the polio period, that time physiotherapists used and they are practiced. So the Mary Macmillan, she established physiotherapy techniques in 1921. Okay, so after that, in the 1940s, polio vaccines developed. So the lots of polio cases eradicated. So the 1940, that time the physiotherapy traction and massage technique, scientific massage technique, and hydrotherapy, exercise therapy used. Then the 1950 physiotherapists, they are enter into the orthopedic clinics. Then physiotherapist focused on the hospitals, and they are working in outpatient visits, orthopedic clinics, and they are working in the geriatric area, they are working in the universities, they are working in the healthcare centers, they are working in the multi-specialty levels. So the 1974, Mary Macmillan, she started a APTA. APTA means American Physical Therapy Association. Then day by day the physiotherapy was developed more. So this is the history of the physiotherapy. Physiotherapy, we are all developed from the World War, First World War, Second World War. So once upon a time, physiotherapy originated from gymnastic exercise. Exercise means it's not a normal exercise, stretching, strengthening, proprioceptive neuromuscular facilitation technique. Okay, lots of technique. The worldwide physiotherapist called as healthcare professionals. Okay, physiotherapist not a rehabilitation professional. Physiotherapist are healthcare professional. Physiotherapist occupational code is 2264. Now, by effort of Prime Minister Narendra Modi ji, in our country, we are getting NCHP Act. National Commission for Allied and Healthcare Professional Council. So as per this council, physiotherapy course duration is 5 years, 4 years theory, 1 year internship period. Now physiotherapist officially we got prefix DR, doctor, and suffix PT as per approved physiotherapy curriculum. So now physiotherapists we are all recognized as the doctors. Now our syllabus more, everything more. So this is the history of the physiotherapy. So I happy to share this history to each and every states of physiotherapists. I am very happy to say this history because lots of people they are putting simple wishes like that. So I want to say the history of the physiotherapy technique. Thank you so much. Bye bye. I am Dr.T. Diwagar B.P.T. Watermelon Star Dr.T. Diwagar B.P.T. MAP. Thank you.